Hello everyone, I'm Dr. Mohammad Salman Khan, consultant plastic, cosmetic and hair restorative surgeons. Today I decided to talk to you about an ultimate guide of hair transplant. So we'll talk about all aspects, हर एक चीज जो hair transplant में होती है, आज हम वो discuss करेंगे. So to understand hair transplant, we first need to understand hair loss. Hair loss की बहुत सारी causes हैं. Top of the list is genetic और mostly यही male pattern genetic baldness है जिसके लिए हम hair transplant करते हैं. Apart from these, hormonal changes can affect your hair. Some diseases can affect your hair like hypothyroidism. Some infections can also affect your hair. Kuch fungal infections they can also affect your hair. Bariatric surgeries can affect your hair and lead to hair loss. All these causes can lead to hair loss. Now, there are two types of hair transplant. It started off with FUT, which is a linear strip जो सर के पिछले हिस्से से एक कट लगा के स्ट्रिप ली जाती है, फिर उसे स्लिवर किया जाता है, स्लाइस करके उसमें से एक एक फॉलिकल को अलग किया जाता है. That is the old method of hair transplant. Still, some surgeons like to do that. I don't. I just like the second one, which is FUE, Follicular Unit Extraction. It is the latest method and I believe the best one. जिसमें आपको बहुत ज़्यादा grafts मिलते हैं, बहुत अच्छे grafts मिलते हैं, and it heals very quick with minimal complications. Now, how do I proceed with hair transplant? It starts off with a consultation. Consultation, I like to do it face to face. Those of you who cannot come to my clinic, you can consult my managers, send 5 pictures, front, back, both sides, and from top. Based on those 5 pictures, I give you a rough idea कि हमें कितने grafts चाहिए, आपका donor कैसा है, आपकी baldness की type क्या है. There are 7 types of baldnesses. So we classify them and on the basis of that I decide कि हमें कितने grafts मिल सकते हैं. I always give a range, 2000 to 3000, 3000 to 4000. The precise number वो तभी हो सकता है when we do a face-to-face consultation. The hair transplant procedure होता क्या है? It's a long procedure, 8 से 10 घंटे लेता है, लेकिन it's a pain-free procedure क्योंकि ये सारा होता है under local anesthesia. So you don't feel any pain. आपको सिर्फ टच फील होता है, कोई दर्द इसमें नहीं होता. सिर्फ जब हम लोकल एनेस्थीसिया देते हैं बहुत ही छोटी नीडल के साथ, दैट्स ऑल यू फील. फिर हम ये करते हैं कि सबसे पहले हम बालों को ट्रिम कर लेते हैं, फिर हम पीछे एनेस्थीसिया दे के वहाँ से एक एक ग्राफ्ट को निकालते हैं विद FUE प्रोसीजर. उसमें एक एक ग्राफ्ट को निकालने में इट टेक्स अबाउट 3 to 4 hours. इसमें आप एक साइड पे लेटे होते हैं, फिर दूसरी साइड पे समटाइम्स अपसाइड डाउन. Then the second step is making sites, which is the most important step in hair transplant. इसमें ही आपके बालों की angle, direction, density ये सारी चीज़ें आती हैं. I do that myself. इसके बाद the final step is placing of these follicles. उन्हें फिर हम forceps के through एक एक follicle को उस एक एक site में रखा जाता है जो मैंने blade से बनाए होते हैं. In this, we offer 2 techniques. Just make regular FUE where we use the CTS cut to size blade, and the other one is Sapphire FUE in which we use the very special Sapphire blade that gives the best result and the maximum density. After the hair transplant, we do a dressing. That dressing stays for at least 24 hours. Uske baad we remove the dressing. I like to do dressing on the donor area. I leave the recipient area open. लेकिन हम आपको कुछ surgical caps दे देते हैं which are disposable and you can wear them so people don't see it. Within 2 to 3 days, the area is healed. फिर हम dressing remove कर लेते हैं. On the 3rd or 4th day, you can take a careful bath. For first 10 days, you just have to be careful with the shower. आप तेज shower के नीचे नहीं नहाएंगे. You slowly prepare shampoo and water and you wash your head. After 10 days, there are no precautions. You can be back to work within 2 days of hair transplant. अगर आपका indoor काम है. अगर आपका outdoor काम है, then I recommend 7 to 10 days. After 10 days, you can go to your gym, you can go and do all outdoor activities. Results of hair transplant, it always takes time. I keep telling my patients, पहला महीना you enjoy it because आपके अपने बाल भी होते हैं, transplanted भी होते हैं, everything looks wonderful. Then they fall off in about 4 to 6 weeks. Next 4 to 6 weeks आपको कुछ नजर नहीं आता. So second and third they are depression months. उसमें you don't see anything. 4th month when they start regrowing. Normally in our races and our people, the average is at 6 months you get about 30 to 40% of the result. At 9 months you get 70%. At 1 year you get the full result of hair transplant. Risks and complications. इसमें सबसे ज़रूरी चीज़ जो है that is the selection of your doctor. If your doctor is qualified, trained, board certified, whatever risk or infection or complication comes in, उसका solution होता है. सर्जरी की जितनी भी किताबें हैं दुनिया में, आधी किताब सर्जरी होती है, आधी किताब ये होती है कि ये कॉम्प्लिकेशंस हो सकती हैं और इसको आप यूं मैनेज करके ठीक कर सकते हैं. Same goes for hair transplant. If your surgeon is qualified, he'll be able to deal with infections, he'll be able to deal with scarring, he'll be able to deal with unnatural results. जितनी भी चीज़ें hair transplant में हो सकती हैं, swelling हो, edema हो, bruising हो, all of these things, they are treatable, they are curable. लेकिन अगर आपका doctor qualified नहीं है, तो that can become a big problem. So my recommendation, work very hard. Look at the qualifications of your doctor. Preferably choose a plastic surgeon with experience in hair transplant. The cost of hair transplant. अब ये सबसे एक ज़रूरी चीज़ है क्योंकि पैसा भी ज़रूरी है और अच्छा काम भी ज़रूरी है. Whatever you are planning for, ultimate result depends on how much you spend on it. Good doctors, plastic surgeons, they're expensive worldwide. They'll charge a lot. So as I. Good things, good equipment, good clinic environment, good sterilization, disposable equipment, ये सारी चीजें they cost. When they cost, so ultimately the patient has to pay for it. But that cost actually defines कि आपको minimal complications होंगे, कोई भी complication नहीं होगी, अगर होगी भी तो वो बहुत इतनी कम होगी कि शायद वो एक आध पिंपल हो जिसे आप सिर्फ पॉलीफेक्स लगा के ठीक कर पाएं. But if you go for a cheaper place, you're going to get severe complications जिन्हें treat करना फिर कभी-कभी मेरे लिए भी मुश्किल हो जाता है. A lot of people come up with unnatural results with very poor hairline. You can see a lot of videos on my page. Correcting them actually costs double क्योंकि मुझे उस पे टाइम भी मेरा ज़्यादा लगता है, एफर्ट भी मेरी ज़्यादा लगती है. पहले मुझे उन बालों को निकालना पड़ता है, ख़त्म करना पड़ता है, उसके बाद मुझे और ग्राफ्ट्स वहाँ पे लगाने पड़ते हैं. So for the first time, try to go to a proper plastic surgeon, get a hair transplant from a center which is well recognized, well sterilized, and who have a history or a legacy of good results. In conclusion, hair transplantation is an amazing procedure. It can change your life, it can change your look. हर दिन जब आप अपने आप को शीशे में देखेंगे, you will enjoy it. So you do it once, but you enjoy it for the rest of your life. Results vary from person to person, but in 90% of the cases, the results are amazing. ये जो 10% जिसमें results weak आते हैं, they are mostly because the patient has weak donors. उसकी भी अपनी एक तरीक़ाकार है how you do it. So it's a procedure that I would recommend every gentleman, whether you are 18, whether you are 60, you can get a hair transplant and you can carry a good look for the rest of your life. Thank you.